Hello, my name is Adam Riedel. This is my 225 intradermal administration medication video remediation. For this, I need a few things: some gloves, my pretend pad patient, some cotton swabs, alcohol swabs, and my multi-dose vial, and then my syringe, which is a milliliter, 25 gauge, 5/8 inch needle. So for this order is 0.1 mLs of tuberculin for this patient. So the directions that were stated to just redraw the medication. So I'm just going to kind of start with that. I'm also going to be mindful of the 6 patient rights. The right patient, the right time, the right medication, the right dosage, the right route, and the right documentation. So I've gone to my patient's room, I've introduced myself, I've talked to them about their adverse reactions, I've verified their name and their birthday. I've asked if they have any questions about the medication administration, so I'm going to begin doing that. I'm going to use some alcohol on this multi-dose vial, and I'm going to make sure that it's not in an expiration date. I would have also washed my hands prior to putting the gloves on while I was introducing myself to the patient, since I have my gloves on already. So I use the alcohol on this multi-dose vial, and then reviewing the MAR or the EHR, it's a 0.1 ml of tuberculin. So I'm going to use this tuberculin syringe here, and I am going to inject 0.1 mLs of air, and I'm just going to try to show you guys that I got there, and I'm going to inject that into the vial, pushing the air in and then injecting to my desired amount, which is 0.1. And I'm making sure if I have any air bubbles, flicking it for that. And let you guys see where we're at there. Hopefully you can see that. And then I'm also going to use some alcohol on my patient. Make sure that's nice and dry. I'm going to insert this at 15 degrees with the bevel up. And I want to make sure that they know to not rub this in. I'm not going to put a bandage over it, to be aware of any adverse effects after the fact, and to come back in 48 to 72 hours to get the TB test read to be either positive or negative. So we'll go ahead and make our C shape and do our bevel facing up and at 15 degrees, and I'm going to administer this medication here. Okay, I've administered it, and I'm going to get out of there, and if there was any blood, just kind of slightly put this cotton on there and cap my needle, and then dispose of this into a sharps container. Make sure my patient's doing okay. Ask them if they had any questions, get them facing okay again, get some hand sanitizer up in here, and properly document this entire process in the MAR. Thank you very much, or in the EHR rather, in the MAR.